It is just a huge honor for me today to be podcast interviewing Dr. Michael Dostal, DDS, the founder of the Kansas City Implant Institute. He completed his undergraduate studies at the University of Kansas City, like all the best dentists do, and continued his dental degree at the University of Missouri, Kansas City. Since then, he is recognized as an expert in comprehensive restorative treatment using implants, full arch implants, full mouth reconstruction, and orthodontics. Dr. Mike has a Midwest heart through and through, but that doesn't keep him in one spot. He has invested hundreds of hours in implant and full mouth reconstruction and training. This routinely takes him across the continental U.S. to assimilate the latest research and techniques. His commitment to education is demonstrated by his membership to the American Dental Association, the Kansas Dental Association, International Association for Orthodontics, American Academy of Implant Dentistry, International Congress of Oral Implantologists, where he has achieved fellowship status. His latest endeavors, extending his passion for dentistry, include mentoring other doctors with a focus on practice growth and implants. He has been incorporating implants in his practice for over a decade, from the single tooth restoration and placement all the way up to life-changing guided full mouth rehab surgeries using all on 5 or 6 techniques. He enjoys every facet of implants. My gosh, I could I could keep going on and on, but I have to stop and say, how was the Chiefs game yesterday?
Oh my gosh, wasn't that amazing?
Oh, I thought
It's
my
a great
mom
time
and I
being
were
Kansas
both
City.
going to have a heart attack.
I know. It was awesome. It was just awesome. I am so glad of the outcome, and just it's so much better when you're down like that, and then you come back, and it's, I think I saw on ESPN today, was a 96% chance that the Niners were gonna win that game with 7 minutes to go, and Chiefs wind up winning. So it was great. It was great. I'm sure. You're a Chiefs fan, Cardinals fan, a
Oh
little
man,
bit of both?
I went to UMKC Dental
Yeah.
School just like
Oh
you,
yeah.
buddy. I mean,
Oh
my
yeah.
gosh, and my mom. I mean, when it was they were down 10-20, I had that sinking pit. I'm like,
Mhm.
and then they won. That was just the greatest game. Greatest game. I mean, I can't remember a Super Bowl that great. That was just an amazing deal.
Mhm.
I'm so excited for you to come on the show because, as I've been saying on the show for a long time, that from Pierre Fichard to GV Black to 2020, cleanings, exams, root canals, filling. The dental industry is an old industry. I mean, it's 2 centuries old, and it grows like the U.S. economy. I mean, I graduated from high school in 1980 to 2020. For 40 years, the economy for the United States, what is it, 1.5%, 3.5%? That's dentistry, except for 2 areas that are in double-digit growth: implants and clear aligners. And so these kids are coming out of UMKC Dental School, just like you and me, and they've got some student loan debt, and they need to do something. What's great about implants and clear aligners the most is that all the government and employment insurance schemes are setting the prices for cleanings, exams, x-rays, and fillings, and they're not setting the prices for implants and clear aligners. And the smartest guy closest to you is Warren Buffett, about 3 hours drive to Omaha. And he says, never go into an industry where someone else sets your prices. And we didn't take his advice. We knew something that Warren didn't know, and we went into dentistry where Delta Dental and employers and all these people set their prices. But people aren't setting the prices in implants and clear aligners, and a lot of dental offices, it's their only profit margin, especially when you get to really government socialized medical schemes like the NHS in England, or Malaysia went from 1 dental school to 11. A lot of these countries where the government has drowned them in price fixing. And in fact, what's amazing is America didn't even start dental insurance until the federal government instituted wage freezes. And then so the union said, well, we can't ask for more money, so we're not going to ask them to buy our house or our truck, so how about dental? And it's like, so we wouldn't even have got into bed with government and employer dental insurance if it wasn't for the stupid government doing price regulations. So now that implants and clear aligners, the price isn't set, Warren Buffett would give you the blessing to go forward into this deal. How did you get into it? Did you get into it because it wasn't a government-regulated price-fixing scheme? Or tell us about your journey. How do you just walk out of dental school and decide you're going to be a blood and guts implant placer?
Yeah, no, It's a journey for everybody. For myself, I got out of school and I did a associateship. We went out to Denver, Colorado, and my wife and I went out there and just kind of enjoyed the mountains and played and did that. And then we came back and started a practice. And after a couple of years of the practice, once it was a startup practice via breakaway. But after a couple of years of the practice and kind of figuring out finally how to do that, I started looking at different ways to increase the revenues of the practice. But then more importantly, I started, once you start restoring the implants that you're not placing and you're thinking to yourself, well, gosh, I wonder if this could have been placed a little differently, a little better, or, it kind of it can get confusing when it comes to even the restoration part of it with, if you refer to a few different people and there's different parts and it can get kind of confusing. So that was kind of the kick for me to at least put my foot in the door with it, is I wanted to, I'm kind of a control freak, like a lot of dentists are, but I wanted to be able to control the placement of it. That way I could control the restoration of it and then all the parts in between. And then, the patients don't have to jump from office to office. They don't want to do that. So that started it with me. I started with the weekend course. And then, I had 5 patients lined up on that Monday after the course. And I'm kind of one of those type. I'll just jump right in. And there were some, some friends of mine, and I did them for a severely discounted rate for them just to kind of get my hands wet with it, and picked and choose easy ones and kind of reviewed them, with instructor, and they turned out great, and it was fun and easy. And then, just like you said, when a patient comes in anymore, I kind of pray that they don't have dental implant coverage on their plan. That way, I don't have to mess with all those hoops, or that they even don't have insurance at all. But
are you starting to see dental insurance plans cover implants?
No, not really. I'm not seeing any increase in my practice.
What year did you get out of UMKC?
2009.
2009. And was your wife in your same class, 2009 UMKC?
She was, yeah. Her father was a dentist in St. Louis who recently retired just in November.
Man, yeah. So it's a genetic disease, and your kids are have they been tested for this? How many kids do you have?
Already she wants to do it. I have my 5-year-old in an orthodontic, orthodontic appliance, functional appliance right now. And now she's loving it. She loves wearing this thing at 5 years old. So she's already saying she's going to do it too, but yeah.
Oh man, that is awesome. You just had a class this weekend. So that was January 31st. What day was that? 31st and February 1st. Was that Friday, Saturday, just here?
Yeah, just here. Yeah.
And when is your next course?
We're having another one in April, end of April. I think it's 24, 25, I believe.
So April 24, 25, September 25, 26. This isn't a commercial. He didn't pay me to come on the show. But I'm trying, when you're a leader, you're trying to, I know what they want to do, but sometimes it's better to learn clear aligners and implants where you have a breathing profit margin. Delta just lowered all of our fee schedules 5% at the beginning of the year. So January 1st, we woke up to, thank you, Delta. They lowered our fees 5%, and it just is what it is. And so I want you to give your best spiel. Why should she learn blood and guts implants April 24th and 25th at your place instead of soft and pretty Invisalign bleaching bonding veneers where you don't even have to put in a stitch?
Yeah, the biggest thing is there's so much need for it out there. And then, and also it's what it can do for the patients. If you have, it starts with the little onesie twosies, that's just kind of getting your feet wet. But then once you advance and start doing, the overdentures and the all-on things, those are the things that really I have found to become fun. Those are the things I look forward to, because when you can take a little 90-year-old 90-pound little lady who hasn't been able to eat for years or go out in public for years because she hates her lower denture and she can't wear it. And then you can put in a couple implants and snap her denture onto it with some locators. It changes her life. And you get hugs and you get gift certificates to places from patients. And, it's just way more fun than just the bread and butter dentistry. So that'd be my advice. The clear liners are great too. I mean, we do those as well, but I think you got to kind of explore both options, find out what you like, incorporate them both, if you really want your practice to grow and provide everything you can for the patients.
Now, how many kids do you have?
I have two, a 5 and a 2 next year.
So is your wife still full time and you guys work together, or is she raising kids?
No, she's still full time. That's her choice. She wants to. She's very proud to be a dentist, and she's very proud to be a female dentist. And
so when that's the case, I don't know. I've never been married to a dentist before, and but do you say, okay, let's not learn the same thing? That's kind of an overlap. Let's not work the same hours. I mean, why would you both work the same hours and do the same things? Do you say, I'm going to work Monday, Tuesday, Wednesday and do implants, and you do Thursday, Friday, Saturday and do clear aligners, or is that how it works, or not really?
No, that's exactly how we structured it at first. She doesn't. She used to work in public health, and she would do the blood and guts extractions and stuff all day long. But she's really tapered away from that, and she just kind of likes to stick to the easy stuff, and she's focused on the sleep apnea side of the practice, and then I do the implants in the larger cases, the aesthetic cases, and it started when we had our first, when we had our only practice. We had staggered hours where she would come in the morning and work afternoon. We'd overlap a little in the afternoon. I'd come in and work till the evening. She'd be able to get home and get the kids and do dinner and things like that. And then I'd finish out the day. But since we, just about a year or two ago, we bought another practice, and now she's over there. She's over there more.
So you had to buy another practice to get your wife out of the office? Is that what you just said?
She's owned it. It's hers now. She loves it. She's the boss there. It's good. She's not under me anymore.
So you got an office in Lee Summit, Missouri, and Shawnee, Kansas.
Correct. Yeah.
Now, I'm from Wichita, Kansas. Would you say it's obvious that the Kansas people are just a little finer than the Missouri people? Have you noticed that?
I cannot comment.
So, how far apart is Shawnee, Kansas to Lee Summit? That's both in the Kansas City metro.
Yeah. Kansas City is like a circle. One's on the east side of town, and one's on the west side of town. So,
it's clear east-west.
Yeah, pretty much. Yeah, they're probably about 20-30 miles as the crow flies apart.
Yeah, and what made you buy another office? What were you thinking about buying? Why did you want to buy another office?
It was something I'd always wanted to do and try out. It was always in the back of my mind. And I did my first office as a startup, and I knew how that worked. And I also wanted to just try to go in and buy a practice where a guy was ready to retire. And I saw a practice where I could add some value to it, by adding implants and adding procedures that we do. And we found one and we jumped on it, and it worked out great for everybody involved. We didn't use a broker. We found the doc and kind of worked the contracts together, and within the first year or so, we probably doubled the revenues of the practice. I go there one day a week to do the implants and do the kind of the stuff.
The Lee Summit was your first office. That was a de novo from scratch, and then
the other way around.
Okay, yeah, so Shawnee, Kansas was a de novo that you started from scratch, and now you said you got out of school in 2009, and then what year did you do the de novo?
2011.
So you went to Colorado 10 so for 2 years, and then you came back and did a de novo in Shawnee, Kansas, and then you did an M&A activity, a mergers and acquisition. What year did you buy that practice?
Just last year, last year.
So 2019.
Yep.
And that's genius. I mean, my gosh, mergers and acquisition are just huge in Wall Street. And every time I meet a dentist that's at the 3 to 5 million mark, taking home 750 or more, it was like, it's always the same story. It's like, we went to a town of 10,000. Those small towns have a dentist for every 1,000 because there's a dentist for every 2,000, and the rural draw is twice of the city. So a city of 10,000 has a draw of another 10,000. So a dentist for every 2,000 would be one out of a 1,000 in the city of 10,000. But every 5 years when the old man retired, this smart old guy would just buy his practice, roll him into his own practice. Whoever's selling the practice, they almost always change your mind and want to come back, work a day or two. But over the years, that 10 doctors in a town of 10,000 turned into 9, and then it turned into 8. and then it turned into 7, and then here you come, and he's my age, he's 60, and it's a town of 10,000 with 5 dentists in this massive deal. And what you just said is that the price is not the price. If the price is $1 and all he does is fillings, and he refers out all of his root canals and his pediatric children and doesn't place implants, man, you can see a practice sell for $1, doing $1 a year in revenue, and come in and make it do $2. It sounds like that's what you did.
Yeah, that's exactly what we did, and it was way easier than I thought it was going to be. To tell you the truth, we got very fortunate, and in the staff, they all stayed. The employees, everybody stayed. They had one lady retire with the doctor, the hygienist, who she was just retirement age as well. But
and what was that? Yeah. What was that retirement age?
She was in her 60s.
60s. Yeah, and a lot of people always say, a lot of people are afraid of that when you buy a practice and some of the older staff retire. Did you get a lot of pushback? Like, well, where's that hygienist that was here forever?
A little bit. You're gonna get that, but we had him send out a nice letter, and we kind of helped draft it, and we got to know him pretty well before we signed on the dotted line, and he trusted us and felt like we were a good group, and it's been great. Yeah, no problems at all.
You know what I like most about what you're doing, and what I'm really in love with it. A lot of times, a dentist, say in Kansas City, wants to learn how to place implants. So they get in an airplane and they fly 3, 4, 5, 6 hours away, sometimes other countries like Dominican Republic or whatever. And then a year later, they have a problem. And it's like, and I always say, well, who taught you this? And, it's some guy in another state. Like, well, why would you have to leave Kansas City to go learn how to place an implant? And then when you go in your backyard, you have a friend, you have a buddy, and you need your friend when something goes wrong. And that guy in another country or another state. So, or is most of your students local to Kansas and Missouri?
Yeah, some from Arkansas, some from Iowa, Oklahoma.
Did you say Arkansas?
Yeah,
it's pronounced Arkansas. Come on, man! The Chiefs just won the Super Bowl, and you're calling them Arkansas? It's Arkansas River goes all the way through Arkansas.
I like that. I'll remember that. But you hit the nail on the head, because they can get up in the morning and just drive to the course. You can stay one night or go home if you're close enough. Do the course the next day and then go home. It's way more cost effective. And even the guy from Arkansas, he drove up that morning. It was like a 5-hour drive or something. He just got up and drove in that morning. He didn't want to stay at a hotel the night before. So.
Oh my God! My dad and I used to leave Wichita 6 hours to where Walmart was. What was that? What was the city that?
Was it Roger? Oh, Bentonville.
Bentonville, Arkansas, because that was where, I forgot the name. It was either the Brown River or the White River fed into the Arkansas River. And whenever you have two rivers of two different temperatures, the fish are they're all there. And that's where we always go trout fishing. So I liked what you said. What you said in the beginning was so profound, because I said, why do you like implants? You say, make a patient happy, an overdenture, a ball. You go to these courses like last week was the Yankee in Boston. And whenever you go to these meetings, when they teach implants, it's always the all-on-4, the 25,000 an arch, the rich dentistry for the richest people. And it's like, that's not America. America it's grandma. She's got a denture, and the bottom one's loose. And in Australia, they just place one down the middle and put a ball in that right down the symphysis. And then the Americans like to make they like two. And but when you go to a lecture at a state meeting on all-on-4, when for every all-on-4 done in America, how many all-on-nones would you say were done?
Oh my gosh. Well, probably one for every 1,000 or so.
Yeah. It's got to be. It's not 1 to 1. It's not 1 to 10. It's not 1 to 100. And it's probably between 1 and 100 and 1 in 1,000. And then you say, well, are you having any courses on the all on none? No. What are you doing after this course? Oh, we're gonna go get lawyers to sue Smiles Direct Club for trying to make ortho cheaper. Oh, okay, okay. Are you guys a trade union or a guild? And so I love the fact that so one of the things I want you kids to understand is that don't decide that you want to go start learning veneers. Where did that come from? You're a dentist in a town. What needs are you seeing on your plate? What's landing on your door? And when you're saying, oh, it's a toothache and they need a root canal, and I don't do that, I'm going to send them out. Well, how would you like to go to a hospital with a broken leg and they say, we don't do legs. We do arms, but not legs. So learn what's at your doorstep. And implants really in a big country like America starts with dental cripples. They got dentures, they got partials, and then next it's probably cosmetic emergencies. Like I'm sure if your wife lost a first bicuspid, she would walk around with her hand over her mouth until it was fixed. And, it'd be a cosmetic nightmare. And like this morning on the way here, I rolled down my window and my wig flew off, and I didn't even hit the brakes and try to find it. So do you think starting off, where do you recommend starting? Is it a loose denture and we're going to do one or two balls and O-rings? Is it a single missing tooth? I mean, you obviously don't start on 4 or 5 or 6.
Yeah, definitely. Just start with a single tooth, an easy posterior, upper or lower, either one. Start with that, get comfortable placing them just with the protocol. And then it won't take long after you do, 10 or 20 or 30 of those, then you can start doing the overdentures and once you get comfortable with the overdentures too, then you can decide and, you're comfortable with them and the processes. You can decrease your fee as much as you want for it, to help the patient out as much as you want. And the rewards are way greater than you'd expect for these patients. It's a lot of fun.
And where do you like to start?
For what?
Where do you think they should start? Where do you think they should get in to implants? What you think it's single tooth? Where do you think is the entry point?
Yeah, definitely single tooth. Yeah, just single tooth, single tooth, single crown, just to find an easy spot and do it, and find some patients that are willing to either a friend or a friend of a friend or someone that could use a discount on an implant and get in there and just go for it. Get some good training, get some good basics, learn the basics of a flap, learn the basics of extractions as well and grafting. But just get in there and do it. And then once you start doing those singles, then you can advance and move on to do the overdentures. And then after that, then you can advance to move on to the all-ons and that was kind of my journey. So it's been good.
So one of the problems that the kids are become aware of very quick is that continuing education in America. They just need to change the Constitution to money's the answer. What's the question? I mean, let's just get focused. And when you look at implant education, it's tied by manufacturers. So if it's so tied to a manufacturer, the kids they're smart. And they come out and they say, I feel like I need to pick which implant I'm going to use because, if you, this whole course is by BioHorizons, which is owned by Shine, or I noticed this one's Noble Biocare and Implants Direct, which is owned by Invista, which is spun off from Danaher, or the Strawman. I mean, they own Neodent, Menditica, Clear Correct Dental Wings. I mean, they own Clear Correct Dental Wings, and they just bought another one. What was that one they just bought the other day? They just bought oh my gosh, I know the name of this, but anyway. So the question is are you implant agnostic? And how do you tell this little girl who's 25 that Strawman courses covering Strawman, Neodent, Mendica, Clear Correct Dental Wings, it's obviously different than Danaher's courses that owns Noble Biocare. They also own Cavo Core, Ermco, ICAT. So how do you separate? I just want to learn implants versus there's a lot of big power dogs out there controlling a lot of that food chain.
Yeah, you're right, and they're gobbling it up even quicker and quicker, And so I think it's good if you can get with a good group of people, and or even a company that offers the main types of implants. I mean, there's the internal hex, there's the conical connections, there's the Morse taper connections, and one that can offer all of those. And then you can kind of learn about all three of those different types of connections, and decide which one you like. And you really might have to learn how to place a couple different types of them, and be comfortable with it. And then, this company that we're working with, IH Biomedical, they're a doctor-owned company, which I like. Dentist,
IHI Medical?
IH Biomedical.
Oh,
They're
IH Biomedical?
they're a doctor-owned company, that I like, and it's a nice compatible system that's got good good prices for everything, which I like too, and they make it easy to place, and easy to restore, and it's pretty nice.
So let's see what comes up under IH Biomedical. IH Biomedical, is that one word or is that two words or
One word, IH Biomedical.
dental implants?
Yeah.
Um, are you? What's the website to that?
It should be. Let's see if I can find it.
ihbiomedical.com. I have found it.
There you go.
Okay, so tell me about ihbiomedical.com. Tell me about that.
Yeah, it's a OT company, all American made implants that they got. I got introduced to them about a year or two ago. A friend of mine introduced me to them and said, try them out, see how you like them. And I tried them out, and I like them a lot. I like the packaging that come in. I like the the ease of placement. They've been working, really great for me. And so, yeah, they kind of just asked if I wanted to kind of help share the word, about their implants, and go from there. And it's kind of how it all started.
So you started to say something about when these kids get into implants, they got to start learning three different connections. You said internal hex. What was the other two?
Oh, a conical connection, and then like a Morse taper type connection.
Conical connection, and then Morse taper.
Yeah.
Okay, well, considering that a fourth of our viewers are still in dental kindergarten, will you go over those three, just elementary? And by the way, if you're listening to this, send me an email, howard@dentaltown.com. Tell me how old you are, what country you're from, or leave comments in the YouTube. But so you're saying, because my question to you is, are you agnostic to implants? That the implant companies are tied very much to the continuing education. So what implant would you recommend for a starter course? I mean, there's 400 implant companies that were at the last Cologne meeting, the last internet, what is it, the Internet Dental Forum, or Internet, the big Cologne meeting every other year in Germany. They had 275 implant companies with a booth out of their list of 400. So she ain't got time for that. I mean, she's 25. Yeah. You've been doing this for a long time. What implant company would you start, and go over those three connections?
Yeah, so I really like this company that I've been placing these implants with now on the website, like you said, IH Biomedical. They're just easy, but the connection types, there's one that's called the internal hex. That's kind of a pretty popular one. It's very similar, like Zimmer's and Implant Direct's legacy type, but it's basically it's an internal hex design. The abutments for it are going to kind of lay right on top of that implant. And then what I really like are the ones that are like a Morse taper type of a connection, where the abutment actually fits on it's a platform switch. So that means that it's the abutment's more narrow than the implant platform, and then it can snug in there and keep it nice and tight, and keeps out all the bacteria, and actually can help tissue growth and soft tissue and bone growth around the neck of that implant. Those are the ones I really like now. And the nice thing about that type of connection, a platform switch, internal connection is when you take off that healing cap, and if there's any tissue that's grown over anything, it's usually okay because the abutment's going to fit on the inside of the implant instead of trying to fit on top of it like a typical internal hex type of implant. So, but I think you need to know. I think you really kind of need to know a couple different types because there's going to be different situations for each one. Like if you're going to place an implant, say near the sinus, if you're going to do like a little sinus bump or something like that, you're going to need like a rounded implant. Whereas if you're going somewhere else with softer bone on the mandibular, you may need a more aggressive, threaded tapered implant to get some good, primary stability on that. So, but I am liking this company right now. I think, an implant is an implant. I don't think the brand name really matters all that much. I think a lot of it has to do with just the person placing the implant and then the patient that is receiving the implant too. So that's why I kind of like this system that I'm using now.
That is so you talked about the internal hex, conical connection, Morse taper. I'm a big fan of your Dental Town posts. I mean, you're really that's why I called you to be on this show. Not just because you're part of the UMKC mafia, but you're just always. I'm going to go over some of your posts. Implants and excess inner arch space. Best way to go. Some of the kids are very confused because the periodontist talks about all this conserving bone, and then they'll watch an all-on-4 case where they'll just go, just trim off all this bone. So it's kind of like, so implants and inner arch space. Talk about that.
Yeah, I come from the side. If you're doing an all-on case like that, then you really need to just make enough room for the prosthetic. I tend to, when I place implants, think of the tooth position first and then work back from there, which is another reason why I like to place the implants myself versus a specialist who might just be thinking, I'm going to put the implant where the bone is, and we'll figure it out. But you have to think about the tooth position first. But yeah. If you don't have enough inner arch space, it's almost every time I do an all-on case, you're doing some significant bone reduction in those cases, and it's hard to grasp with the first couple times you're doing it because you're thinking, just like you said, as a dental student, you come out, you're like, I have to conserve as much bone as possible to make this work. And then you're going in there and you're, hacking off huge chunks of bone. But it works. It gives the prosthesis enough length to be strong and stability and have good stability.
Now, are you I'm going to one last question on that IH biomedical. Is that a type of implant or is that an implant store that sells multiple kinds?
It's a store that sells 4 different types. Four different
brand names?
They have 4 brand names in their store.
And what are the 4 brand names?
IHEX 2, Morse Torque.
Whoa. I'm okay. What's the first one?
IHEX. It's the internal hex.
IHEX is the name of the implant.
Mm-hmm.
Okay. What's the second one?
The second one is IHEX 2, which is another internal hex, but it's a self-tapping implant.
Okay.
It has a very simple way to put it in.
Okay.
And then the other one is a Morse Torque implant, and that's the one that has wide aggressive threads with the rounded end, and it has that Morse taper connection.
Okay. And the fourth?
And then the fourth one is IH Active, which is a internal connection as well, conical connection. It's very similar to like the Nobel Active.
And are you when I got out of school, all the legends in implantology that had placed 10, 20, 30,000 implants had done them all on a pano. And nowadays, you hear millennials talk about a pano, you'd almost think it was some evil villain that was doing something incredibly evil. But that used to be the greatest thing in all of dentistry. In fact, I still think the greatest achievement ever achieved in radiology was not the CBCT, but whoever figured out how to put that R on one side and the L on the other. I thought that was the greatest thing in oral radiology. But are you doing this all on CBCT? Are you agnostic to that, or is there some software machine combination that you think's more intuitive, or where you at on all that?
Oh, I think you don't have to have a CBT to get started. There's some techniques you can learn with a pano and bone sounding, that you can start placing the easy implants. And if you have a mentor or someone you can call and run some cases by, then they can kind of walk you through it too. But a cone beam makes a huge difference in everything. You can also, it can also be a little dangerous, I think, because it can kind of have the confidence a little too high. And if people are, using surgical guides, and if that's, I kind of feel like you need to learn how to place implants without a guide first, and then you can go to the guided cases. Because there's going to be times where the guide may not work, it may not fit, or you can't get your instruments in there, or something like that. Or I had a case where I had a all on 6 case, and we go to reach the guide. It was a case we are doing guided, and the one of my assistants had heat sterilized the guide, and it melted, right? It melted, so it distorted it, and we wound up having to do the case freehand. But it was, but with cone beams, it makes a huge difference. They're fantastic, and the price has gone down on them so much. They're getting.
Well, let's talk about that, because I'm gonna your phone. What do you have, an iPhone or a Droid?
I have an iPhone.
And how old is it?
I think I've got a iPhone 7.
But what year? This is 2020. What year? How old is it?
It's probably 2 or 3 years old.
So that's the thing that I get confused about, because when I go to the MDs and they have 58 specialties, nobody expects the imager to be there. You go there and they say, hey, here's a refer. And where I'm at in Phoenix, it's in the same building. You just go down to the other end and there's a lady there and she's got 4 or 5 different machines. And you, after 2 years, want to upgrade your iPhone, where sometimes they buy this $100,000 CBCT and they're like, my God, after it was a 5-year lease, and as soon as that lease payment's off, that's so great because I'll never have a lease payment again till I retire. And it's like, dude, you're on a Motorola Nokia flip phone. And so how do you balance the fact that the consumer patient doesn't expect you to image, the fact that all the dentists upgrade their iPhone every 2 to 3 years, and so versus sending them out to imaging. So how would you wrap your amazing mind between refer to an image, have someone else do all that and read it, or do it in-house?
Oh yeah, definitely do it in-house. I mean, you can find a used cone beam. Like I actually used a company called Renew Digital for my first cone beam that I purchased. It was a Sirona. It was used, a few years old, and I think you can find them on there for 40,000, 50, sometimes even less. Get a really nice, and not a plug for this company or anything, but they've been fantastic. We actually had our server go down a couple of weeks ago, and they've had to reinstall all the software, and they've spent weeks trying to get this going, my cone beam going again, and for really no charge, because I bought the machine from them years ago. But yeah, I think you can get into it pretty affordably, and lots of times they pay for themselves. I charge the patient for it, $147, and tell them it's just kind of part of the process. If you're interested in implants, or if and for endo, I mean, it's huge for endo. It makes endo so much easier to have a cone beam for endo, to go in there and measure the canals and see how many canals there are, and it takes a lot of guesswork out of it.
Well, you just said something very, very profound, and that is you just actually mentioned the best feature of having imaging in a house, and this has been going on a long time in dentistry, and that is for the sales presentation, the close, the whole 9 yards. People, I mean, like, I don't even know I'm going to McDonald's until I see it coming up on the road, and I think, hell, I'm going to change lanes and go. I mean, 2 blocks away, I didn't think about it. And we saw this in orthodontics a long time ago, where dolphin imaging came out, and it was a huge success because people would come to the orthodontist and say, do I need ortho? And the orthodontist is sitting there like, I can't say anything. I mean, I haven't seen a Ceph or a Pano. I mean, I can kind of tell you this and that, but it's all contingent on I need a. So Dolphin came out and said, look, when they come to ask the orthodontist if they want ortho, they want to know the answer now. So Dolphin came out with a deal where the patient was in there and they put some, it was all designed to take a Pano Ceph and trace it instantly. So the orthodontist could tell you. I'm sure if Laura walked in with her 2 kids with the orthodontist said, does my baby need ortho? She doesn't want to hear. It's like when you're watching a movie and there's no close. Stay tuned for next week for part 2. It's like, part 2? I wish I would have watched the whole thing next week. I don't want a part 2. So for the close, when people come in, they say, you're going to pull that tooth. Can I have an implant or whatever? It is nice to be able to image it on the spot and tell them your doctor thoughts. So it definitely increases the presentation, the cells, the close, all that kind of stuff like that. So go over so your next course. Here's where the commercial starts. Brought to you by me, not you. So your next course is April 24th to 25th. That'll be perfect because you'll have just got done paying your taxes to the mafia, and now you'll need to go out and try to sell plasma or something to get back in the game. What is your curriculum for that course? So if she came to you the 24th and 25th, is that in your office in Kansas City?
Yeah, it's in the Lee Summit office. Yeah.
The Lee Summit office?
Mm-hmm.
And how much is that course?
So the normal price is $39.50. Right now we have it discounted to about half off of that, so it's $19.50, and that comes with 14 hours of CE, and it comes with
so it's $2,000 in Lee Summit, Missouri, which is Kansas City, and so $2,000 April 24th and 25th, right?
Yep.
And where's the information on that course? That is at
That is
at KC Implant Institute?
Yeah.
KC Implant Institute. And my God, and so the Kansas City Chiefs won't be playing on that date, but the Kansas City Chefs are actually even better. I still miss Westcourt and the Buttes and the Plaza. My God, that's some of the best eating in town. But so anyway, so it's a 2-day course. What are they going to learn? What's the curriculum like?
Yeah, so the first day we go over all the basics of implants, the flap design, some tips and tricks, just kind of all the basics so that everyone is on the same page. And then we do some life surgeries in there. I really encourage the participants to, if they have some cases they want to bring 5 cases or so, and we'll kind of customize them and go over them with you and pick out the implants for them and kind of talk about how you'll do the case.
Will you actually do the case?
Will I do their case?
Yeah.
Well, no, I mean, I'll have some patients lined up. I'll have some patients lined up that they can, that they can watch me do some procedures on. Now, in the future, I am hoping that we can have the participants bring their own patient, especially if they're licensed in Kansas or Missouri. That'd be pretty easy to bring your own patient in and do it there.
So are most dentists in Kansas legally, can they do dentistry in Missouri?
You have to have a separate license.
Yeah. That's Arizona. Did you see how Arizona became the first state to honor any dental license in any state?
That's fantastic.
Yeah, it's so cool because it's just mean when in the 30 years I've been here, it'd be like some 50-year-old dentist, born and raised, his kids are all out of the home, they're all out of school, and then he gets like some disease, and he needs to be in a hot, dry area if it's lung or MS or whatever, and then they come down here and they're trying to, get him to take these boards and all this stuff. But yeah, Arizona is so cool. But I'll tell you a workaround that you can do that Chris Volchek did down here, and that is you go to the board. If your patient is a homeless guy or a vet or someone in need, and you say, okay, I'm teaching a course, and dentists are going to come here, licensed dentists from around the United States or Kansas or Nebraska or whatever, they're going to come to the course, and we want them to buy a course license for $100. you just cannot be that government worker that has to answer to Channel 10 News that says, no, you can't come to my state and work on a homeless vet. I mean, I'll never forget the faces when you pitch. It's like the Supreme Court. The Supreme Court, there's a million cases each year. They cherry pick that case to where it's the perfect test case. You know what I mean? And once you go up there and say yes or no, can a homeless vet in my office be worked on by another dentist licensed in America? Well, if you say no to that, you should just quit your job today and file for unemployment, because this is not going to go down pretty on social media. And that's what they're doing. They're doing it in Phoenix now. They're doing it in New Jersey. They're just going to, in fact, it's really, really cool, because some of these homeless shelters, people are going to BioHorizons, which is owned by Stan Bergman and Henry Schein, and they're saying they'll find some homeless shelter, and Schein will put in a operatory or a clinic or whatever. Then some local dentists will start having hands-on courses for root canals or implants. Everybody's winning. I mean, Stan Bergman wants to do a lot of charity. All rich people at that age start wanting to do a lot of charity. Have you noticed that? Just right before. No, I'm just a joke. But no, I mean, twice in the middle of nowhere in a jungle in Africa, I've all of a sudden walked into like the nicest dental office I ever seen. And sure enough, it's built by Stan Bergman and Henry Schein, and it's all charity and all this stuff. But it's really, really cool. So if that license thing's an issue, start working that angle. And I also noticed the difference between boys and girls. A lot of boys don't care about going down to Mexico or the Caribbean to learn implants on, but a lot of women don't feel safe about doing that. It's one thing if you and me want to go to the Caribbean and drink beer while we're placing implants. But there's a lot of girls who just don't think that's a good idea in Central South America. So having them do a hands-on course. So my deal is, my God, don't learn how to place implants unless that guy is real close to you and can help you when the shit hits the fan. Because on their first 100 implants, how many in all reality are going to fail?
It could be, it could be significant. It could be 20, 30% probably. There's a good chance. Yeah.
And ladies and gentlemen, that might have been the most honest statement ever told by a dentist on any podcast in the world. He just said 20 to 30% of your first implants are going to fail. And let me give you some sourcing for that, right? So it used to be these DSOs, and I don't like the term DSO. I like the term group practice, because dentistry, like medicine, is moving to group practices for a lot of reasons. One is the same reason why I got an associate when I got right out of school. I was bored. I mean, hell, you just left 120 drinking, partying, crazy dentists and UMKC, and now you're by yourself? Well, that wasn't fun. And to show you how dumb I was, my first associate was just as young and dumb as I was. I mean, I should have got like an old wise guy, but I was looking for fun. So group practice dentists are having more fun. When you do buy that CBCT, now you can share it among 3 or 4 people. That's why medicine has rapidly consolidated. When you buy an MRI machine or a dialysis machine, you sure as hell can't have one for every MD in town. And so it's just a lot more fun environment. But then also when something goes wrong, someone's there. But these DSOs, as a group practice, one location turns into a group practice, more than one location. I would say the average, what people call a DSO, they always talk about Heartland and Aspen and Bob Fontana or Stephen Thorne's Pacific Dental. That all 3 of those have like 1,000 locations. Well, those are 3 huge outliers. Most DSOs, the sweet spot is between 5 and 30 locations. That's all the DSOs. And all those DSOs, they used to take young kids and send them to courses like you and have them to teach implants and all that stuff. But now they're bringing in periodontists to place the implants. Why? Because when these kids come out of school and they work for you for 2 years and they place 30 implants, well, over the next 5 years, you're going to have to pay a periodontist to redo, like you just said, a quarter to a third of them. And it's not cheap. Number 2 is the insurance company. If I do the molar root canal, Delta will give me, say $700. But if you're an endodontist, they'll give you $1,200. So if I have a general dentist do it and I pay them 25%, I actually net more money having an endodontist do it, even though the endodontist wants half the fee. 50% of the higher fee is more money than 25% of the lower fee, after you work into the fact that when endodontists do 100 molar endos in 5 years, 60 months, 5% are extracted, whereas when general dentists do it, 10% are extracted. Shit fails. And when you place your first 100 implants, that isn't the same success rate as someone who places implants 500 through 600, or 5,000 through 5,100, or 10,000 to 10,100. So I recommend don't fly around the world. Drive to someone in your backyard so that when these 1 in 4 fail, you can actually go talk to somebody.
Yeah, I agree 100%. I mean, and I always give my phone number and email out to everybody that comes, and they can call me and text me, and they do. We talk through cases, and the cool thing about the courses that we've had, they're so relaxed. They're kind of like a study club type thing. Everybody kind of chips in things, and you always wind up learning something when you do these courses too, from somebody. Somebody shares one of their tricks, or you kind of share your frustrations with practice and what's working for you and what's not. And it's kind of nice getting back to that small study club type mentality. So it's been a lot of fun. It's been a really good group of people we've had, and everybody's gone away, satisfied and happy they came. So
who's the founder and CEO of IH Biomedical?
I know it's some dentist owned. I'm not quite sure who all of it is, to tell you the truth. But I know it's dentist owned. I know they're all American made parts, and everything's American made in the Midwest and on the West Coast. But yeah.
Huh. Okay. Very, very interesting. So when
I
you
do,
go ahead.
I do know too that they said that with the course and the CE and everything, that you can get some. Everybody should be able to pick out about 5 implants or so, and they can take them home with them, or have them ordered as part of the registration fee for the course as well.
So when I got out of school, implants, my gosh, in '87, the goal of an implant was the longest implant possible. I remember when I would start placing implant, side, you had a pano, but you'd have that 14 millimeters, 16, 18, sometimes a 20, 22. You have like 5 laying out, hoping you could get that. What you wanted to do is get the implant to go out the back of their head, around the moon 3 times and back in. And so it was sinus lifts all the time. But now implants are getting shorter, faster. There's sinus bumps. How does a sinus lift look today in 2020, say, then versus 2000?
I think they're pretty rare and far in between. I wouldn't be, if I was starting my journey in implants, I wouldn't be too worried about it. Learning that procedure right now, you can learn with the short, like you said, the shorter implants and the bumps you can do, and the things you can do with versa burrs, and the crestal lifts you can do with those. It's, rarely do you have to do lifts like that. I don't do lifts like that. I've only had to send out one or two in my entire career where there was absolutely nothing to work with. But and that was even before I started, doing these bumps and these sinus bumps and doing the versa burrs. But I just don't think I wouldn't worry about it very much. They're starting to be pretty rare, in my opinion. And even with these all-on cases that you do, where you're putting those implants isn't in the back, and the way I'm doing it, but in the way I've been taught to do it. But you're putting them in the front where there's lots of bone in the front, and then I just wouldn't worry about it too much. I think, like you kind of mentioned too, it's good to learn immediate implants. Because like you said, it's going to be a lot more trauma type things, long term. It's going to be less of the cavities or the things like that we're fixing now, but down the road, it's going to be people who've fallen, or they've had a root canal in post, number 10 that breaks off when they bite into a piece of crunchy bread, and they come in and they want it fixed right away. So we touch on immediate implants, and also touch on how to put a immediate screw retain provisional on those implants too, after tooth extraction and placement, and the type of implants used for those. So we kind of touch on all those things.
So are you back to the CBCT? Are you agnostic to the machine? Is there one you think that's better?
No, I think it's actually more about the software. You have to play around with the software and know which software you like. And for me, it's quick. It's how quick you can be with it and how easy you can use it. I don't want to be.
Which software? So you're saying that the CBCT to you, the value of the CBCT is not how they throw an energy wave; it's the software.
Yeah, I think so. I
And
mean, yeah,
which
you
and
want
which
to.
which software do you like the most?
Well, I use the Sirona, what's it called, Galexis. That's the Sirona brand. I have a Sirona Orthofos. Um, it's just the small field of view. I think it's like 8x8. That was the first one I bought that was used, and I think you can even the same model I have. You can even get it cheaper now. Probably $30,000-$40,000 with a small field of view. But the software is pretty slick on it. I'm sure people are biased based on whichever one they've learned. You know, but but if I can take the cone beam
And when you
within.
said you got it used, so you bought the Sirona Galaxis. So Sirona is out of so when I got out of school, Sirona was part of Siemens, which is kind of like Johnson Johnson and Gillette, and then some CEO thought they were overweight in healthcare, so he spun it off. But the building didn't move in Austria; it still sat there. The people just loved it; they loved it. They were freed from that, and then it decided to get married to Dentsply out of York, Pennsylvania. So the Sirona is now the Dentsply. But when you said you bought it, you said you bought it used.
I did,
And
yeah.
where did you find it used?
Renew Digital. I believe I
Renew
found it
Digital. Yeah.
through someone talking about it on Dental Town. And yeah, they've been an awesome company.
Right. And so how long? So you like the Sirona Galaxis CBCT because you think the diagnosing the software, the treatment planning software, is more intuitive and easy.
Just quick and easy. Yeah, that's what I like because I don't want to spend a lot of time trying to get the right slice and moving it around and everything. You
And
just
what did you pay for that Sirona Galaxis from Renew
at
Digital?
the time, I think it was a 2012 model, and I bought it in probably 14 or 15. And at the time, it was 62,000. By the time they
See,
installed
guys, you're so
it,
smart, man, and you
yeah,
find this. So, were you born in Kansas or Missouri? Because you sound like you were born in Kansas, but
yeah, Kansas, yeah,
which side were you born in?
Kansas
See,
side,
I
yeah.
knew it. I flipping knew it. He don't sound like no Missouri boy. So you buy a new car, you drive it off the car lot, and it loses 20% of its value. And a
Yeah.
lot of dentists will sit there and they want to build a dental office. It's like you want to build a dental office, so you got to buy land, and then you got to go get legal fees, and you got to go pay architectural fees, and you're gonna design a building. I mean, when you the smart people, when you build something in America, it's about a 100-year cycle between a brand new house for a rich guy versus 1 century later. Now it's a crack house and a bulldozer's about to hit. It's about a 100-year cycle. And you find guys like Rick Kirshner. He owns 300 dental offices and he didn't build one of them. He goes and he drives around until he finds like an old 2,000 square foot State Farm building or chiropractic building. I was in Tennessee, one of the coolest dentists in the world, saw a bankrupt gas station. It was one of those ones with the dinosaur on it. What was that?
Sinclair.
What was it?
Sinclair.
Yeah, Sinclair. He bought an old Sinclair gas station and tied in the dinosaur to the decor. It was so damn cool. But the thing is, I mean, he picked that up for 20% of replacement cost. So here's a $60,000 to $100,000 CBCT, and you picked it up for $14,000, right? Or is that what you said?
Well, no, I bought it in 2014. I think so. It was probably $100,000 CBCT that I bought used for about 60.
Okay,
Now
so you
you
say 40,000.
Yeah, and now you can even buy the same model, even for like 30 or $40,000.
And Dental Town has the Dental Town classifieds averages about 5,000 ads. They all go away after 120 days, so they're all current. And I mean, like someone will want to get into CAD CAM, they'll say, "Yeah, I talked to Patterson and Shine, and they wanted 140 for this. I picked one up on Dentaltown used for half the price." I mean, just be smart.
Mm-hmm.
In fact, I got my dental degree on eBay, $10.
Okay.
And it was a part of a black belt Eagle Scout oral maxillofacial surgeon all in one. So just be smart with your money. So you like so the key point he said there is buy used, and it's about the software, the treatment planning designing software is the most important part around that, right?
Yeah, you got to save some money and find something that works for you. Find something that's easy. You can learn and quickly
Okay,
navigate
this
around.
next question, I want you to tread carefully on, because when you come out of school, the young are very easily manipulated by old patients, where they're the dog and they're going to wag the dentist's tail. And they say, "Yeah, I want that implant. I want it immediately." And they just, and it happened to me. They talk you into things where when it goes wrong, you're just thinking, "Well, how was I talked into this?" And
Right.
it was like, "Well, you're 25. This guy was 60, and blah blah blah." But how do you manage patient expectations? How do you, as a dentist, remain the dog wagging the patient tail? And how do these kids avoid getting into trouble because sometimes you ask them, like, "Well, what the hell did you do that for?" That's what he wanted me to do. I know,
Yeah.
Howard. I know. I told him it was a bad idea, but he told me to do it anyway. And it's
Yeah.
like how do you do it? Because I still see a lot of stuff that shouldn't have been immediate. I mean, what's wrong with? I mean, if my doctor told me, "Okay, Howard, you need a quadruple bypass, but your insurance will only let me do one valve a month, so you'll I mean, how do you maintain control of being the doctor when someone says, "Yeah, I want those implants. I want them immediately loaded, and I'm going to a wedding the next night, and I want it to look perfect." How do you manage expectations?
Well, you have to educate them first. Tell them the reasons why that it's not going to work like that. But I always try to keep the expectations low anyway. And I feel like as GPs, we kind of have a little bit of more of an advantage than specialists when it comes to things like immediate implants, because like I was talking to a periodontist friend of mine, he's saying I can't do a lot of immediates like that because if the implant doesn't take, then I've just lost that referral source, and as a GP, we can, build have a good relationship with the patient, a good trusting relationship, right? If I usually tell them, like, look, we might try an immediate here. It may not be a great case. If it doesn't take, it's okay. All we lost was time. It's not going to cost you any more money or anything if it doesn't take and we have to replace it. We just lost a little bit of time. But you have to know which cases you can do that in and which ones you can't. You have to have a good bone. You have to have a nice, easy, clean extraction. Can't be a big surgical mess in there. Big nasty surgical extraction. But you just gotta pick and choose your battles. But I'm not afraid to stand up to a patient and stick with things within my comfort level. And I encourage everybody to do the same thing. If it's not comfortable for you, then don't do it.
And I've called the police on a patient every decade for 3 decades.
Oh, wow.
I mean, when we're talking and all of a sudden it goes south, the next thing you're dropping f bombs and calling my assistants names and all that. I don't have to explain to you what's wrong with that. You're in a
Yeah.
public building, and the laws in healthcare. And the first time I did it, I tell this story. I was so mad, but anyway, when he was going for the judge, I thought I'm gonna go down there just in case he starts saying it was something else. Never even called me. You know why? When he went in front of the judge, guess what the first thing the judge said to him?
Mm.
She looks over at him. She says, "What did I tell you the last time you were in my courtroom? What did I tell you?" And he's like, that you never wanted to see me again, and I'm seeing you again. You know what I mean? I thought, I'm so glad I did that, because she just
Perfect.
about she probably would have come down there and just beat the crap out of him if she legally could have. But anyway, yeah, you just you're the doctor, And the thing about implants, here's the dark side of implants no one's going to tell you. If you do 5 implant cases and one of them fails, you're going to fix it for free from the profit dollars of 2 other of those 5 cases. So you should have just done 2 cases for money. And by the way, if you ever do find someone that's poor and can't afford to have it done right, well, then do it shitty. Because then when it fails, they're going to go to someone else, and that person's going to call an attorney, and you're going to pay for the best implantologist in the world to redo a Mercedes-Benz. So, if you can't do it right, do it wrong, and you'll pay to have someone else do it right. And implant cases, for every 5 you do, if one fails, 2 of the other 5 profit dollars will go to do that. So diagnosing a tree implant is everything. And I know we passed the hour, but 2 more. Can I hold you to 2 more questions?
I'm fine. Yeah.
So on the guides, I mean, I know when you're an alcoholic in Phoenix, the old dentists are saying, I placed 5,000 implants. I never had a guide. Use a pano the whole time. And then the kid's trying to justify why he needs a CBCT and wants everything guided surgery. So obviously the old people, pretty much I would say every single person alive today that's placed 30,000 implants did at least their first 10 with no surgical guides because it didn't exist. So surgical guide, are you... is it like a rubber dam on a root canal 100% every time, or is it sometimes yes, sometimes no? How do you wrap your mind around a surgical guide?
Well, I think you have to learn how to place them without, first of all. That's kind of my opinion. Just make sure you know how to place them without. But I only use them for the cases where it's going to be really tight in there. If it's super tight, or if it's something that an angulation case where, if you're doing like an upper all-on case and the angulation has to be just perfect because they don't have a lot of bone to work with, then that's when I do guided on those. But for 95% of the onesie twosies I do in the lower overdentures and things like that, then I don't do those guided. Just kind of have a nice flap where you can see everything, where you can see the bone and know where you're going. And with the cone beam, you kind of know your width and what to stay away from. So I'm not a big fan of guides, and it also just kind of adds a little length to the time to do it, unless you're printing your guides in office, which I'm not doing. I know some guys are, but then you have to wait for turnaround for that too. But there are some cool things you can do with them. I do some immediates on the upper that like I said, like a number 7 that's broke off at the bone level and you got to take it out. You can do it guided and have the provisional made, all ready, so you place the implant in and the provisional's already made and just screw it right on. And, it works pretty good. But on that same token, if your guide's not right, or the implant angle gets off, or something somehow gets off, that provisional is not going to go on. So then you either have to have a backup, flipper made, or you have to be able to know how to make a provisional, chair side with what you got. So I've had all those happen to me before.
So we were talking about CBCTs, we were talking about surgical guides. Now there's some new technology with image navigations where they're tying into your CBCT and your high-speed drill. Do you think is it bleeding edge? Is it leading edge? Is this something where you're thinking, I wish I had some image navigation?
Not at all for me. I'm not very, I'm a pretty hands-on guy. I would feel pretty nervous about that. I'd have to see a lot of it done, and a lot of it done successfully to go that far. But I mean, do we have to do that? I feel like if you have good basics, good fundamentals, a good surgeon can get it done. So.
And last question. I mean, I'm confused because she could go to your website, Casey Implant Institute, and for $2,000, which is about what your first implant. I mean, a single tooth implant is going to be $2,000. It's going to be an implant and a crown, $2,000. And you're having that course April 24th and 25th in your Shawnee, in your Lee Summit, Missouri, right?
Yeah, in our Lee Summit office.
Yeah. So why should she do that when the Chinese already have a robot that places an implant, and I could be sitting in my jacuzzi drinking a beer while my robot is at the office placing an implant?
I can't imagine how expensive that robot is, but it's probably way more than used cone beam or something. But implants they're a good practice builder, good revenue generator, and if you're hands on like I am, and then plus you're going to be restoring them, so with the system that I'm using from IH Biomedical, we can get the even the restoration of everything, the cost down to, I think it's about 200 to 250 or so by the time you do the implant and the crown and everything, just for a single posterior. I mean, that can be pretty cost friendly when sometimes you're paying $800 or so, if you're using some of the other brands. Like the office that we bought recently, I've been having to restore some of the implants that were referred out previously to specialists that are coming in. And I looked at my lab bill the other day for one of them, and it was like $400 or $500, by the time you do the abutment and the crown. And I mean, that stuff adds up. So start doing it. If you want to do more of them, decrease your fee for it, because you got a little more margin there. And and if you want to really change some people's lives, you can do even more of them. And that's part of another goal of mine with this institute, is to try to not only help the local docs, but help the local community too. And I want to try to do some free cases, like you said, a veteran or something like that. I want to try to do some free all on cases in the future for people, and just kind of make it good for everybody.
And if you did buy a Chinese robot and you were at home in your jacuzzi drinking beer, would you drink a Corona beer with the coronavirus breaking out on your Chinese robot, or would you switch from your Corona beer and drink Ebola beer while your Chinese robot was placing him? Hey, thank you so much for coming on the show today. It was just amazing. And this is implants and clear aligners is the only double-digit growth in dentistry. I went to UMKC. Everybody I know back in UMKC has been telling me, you got to get this kid on your show. He's just amazing. So Michael Dostal, go to his website, KC Implant Institute, and his next course is April 24th and 25th. Or September 25th and 26th. And it's kind of like ortho. Like Rich Litt teach you how to do ortho. And his 4 3-day weekend course is like $5,000. Well, what is your first ortho case cost? $5,000.
Right.
This is a $2,000 course. How much is your first implant case? $1,000 implant, $1,000 crown. By the way, are you lab agnostic, or do you usually only use one crown and bridge implant lab?
No, I unfortunately use about 4 or 5 different labs. As confusing as it can be for our technicians, our assistants, but yeah, I mean, I spread it around. There's certain ones I like for certain things.
Okay, well, congratulations on all your luck, and congratulations on doing the smartest thing any dental student can ever do, which is marry one of his classmates. That was just sweet. Whose dad is a dentist too. I mean, talk about that's the. I mean, really. So, thank you for all that you've done. Thank you so much for coming on the show. And go Chiefs!
Go Chiefs! That was great. Thank you, Howard, so much. I really appreciate you and everything you've done. And I actually watched your VHS tapes of your 30-day dental MBA that my father-in-law gave me. I thought I'd throw that in there.
And now it's on YouTube.
Yeah,
it's on YouTube. And the funniest thing is, a lot of dentists, and on iTunes, a lot of dentists say to me, well, I can't believe it, because that stuff's 10, 20 years old and it's still the same. It's like, well, geometry, calculus, algebra, business, it's not going to change. And, until we evolve into some species I haven't seen yet, it's business is business. It's people, time, and money.
Yeah, very good.
All right, have a rockin' hot day. Good luck with those 2 kids.
Thank you.